Today on the Dr. Steve Show, new hope with a cutting-edge eye surgery. Watch as a surgeon implants a new iris.
This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, one of the first things people notice about you is your eyes, especially if there's something abnormal about the iris, the colored part of your eye. Well, my next guest is a surgeon who's pioneered an amazing technique to correct eye problems with life-changing results. Dr. Kenneth Rosenthal is here now joining me. Ken, good to see you.
Thank you. Thanks for having me on.
So I want to talk about this surgery because it's pretty amazing. Basically, you can give people color to the iris in the eye if there isn't an iris or something. So who would be a candidate for this kind of procedure?
Right. Well, first, I'll take a slight step back from it and say that the iris has two functions. One is to produce a cosmetic appearance of symmetry and beauty, as you said. But the more important role is that it modulates the amount of light that gets into the eye, and so it affects patients' vision and their visual comfort. So patients who are missing parts of their iris have colossal amounts of visual discomfort and sensitivity to light, which is disabling.
So there are real medical procedures where people might have an abnormality with their iris, or they're born with a problem with their iris?
Exactly. So we've concentrated on patients who have congenital aniridia, which is a patient who's born without the iris, patients who've had injuries, patients who have had injuries related to complications of cataract surgery, for example.
All right, so here we got a couple.
We
got a couple of photos of some patients. Describe to me what we have here.
So this is a very nice woman who was in her 60s who came to see me from North Carolina, who had been hit in the eye with a tennis ball. She suffered a retinal detachment, and her iris was completely destroyed, as was the lens of her eye. And in the top picture, you can see her left eye, which is a black hole, and she had poor quality of vision in that eye. So we went ahead and put an iris prosthetic implant in her eye. We took a photograph of her other eye, matched it perfectly, and it was hand painted and then implanted in her left eye.
I mean, that's astounding, because essentially when you look at her in the bottom, which is the after picture, I mean, it's like a normal eye. Completely normal.
The technology is astounding, an ability to reproduce a normal appearing eye.
All right, so here's another example. What do we have here?
Right. So this is one of our most wonderful success stories. This is a patient who at the time was 17 years old. He had congenital aniridia, so he was born without the iris. Colossal amount of sensitivity to light, decreased vision. He was legally blind. And we implanted, you see on the photograph on the top, after we implanted his left eye, and you see a relatively normal looking iris, and you see on his right eye, by contrast, how he was born.
Right.
And on the bottom, after we've done his second eye. And I will tell you that not only does he have vision from legal blindness, went to vision adequate to drive, to go to college full-time, to perform as a musician, but has a normal life as a result.
That's amazing.
And the color and the appearance is absolutely natural.
Okay,
nobody can tell.
So by looking at those photos, there are some people also who are born with two different color eyes. We see this in dogs all the time, right? So you see a person, one eye's brown, one eye's blue. Would that be a person who you would say could have this surgery?
Right. And so this is an example of what we call genetic mosaicism, or something called calico, like cats have a lot, as you said. And the answer is short. If there's nothing physically wrong with the iris, even though they're different colors, my personal view is that given the technology we have today, I would not recommend treating that patient, because the technology that's available is not, in my opinion, is not sufficiently well developed to warrant doing this purely for cosmetic reasons.
Because there can be side effects.
There can be side effects. And in fact, we haven't seen the patients who have done well with this, because these aren't done in the United States. They're done in Panama and in India and in Turkey. But we have seen complications. We've seen lots of them at New York Eye and Ear Infirmary. We have about 16 patients who've suffered serious sight-threatening complications, 2 patients who've lost all of their eyesight as a result of these done purely for cosmetics.
So in other words, basically they had healthy eyes, they had liked to change the color, and now they're blind.
That's exactly right.
So basically, if you have brown eyes and you don't like your brown eyes, you should not have this procedure done just to change them to blue because, you know, you want blue eyes.
Right. I think the technology will eventually evolve. We'll be able to do that. But this is not like doing regular plastic surgery.
Right.
It just is not, my opinion is that the technology hasn't evolved enough.
Okay, so in the future, is there another procedure, maybe a laser or something that can work with this?
Well, I think the potential for developing colored implant is there. And we're working with the companies now to try to produce something that's safe. But we don't, my opinion is we don't have it yet. I'm also working with a company that has made a laser that can be used to remove the pigment from a dark iris to make it light. Now, again, these are not FDA approved. They're not available in this country, and we're just starting to look at doing some clinical trials for that technology. I think that has some promise as a less invasive, possibly safer, but we won't really know until we've conducted the trials. But that's something that's close down the pike.
Okay, I want to get to the actual surgery itself, where you
Sure.
actually implant the silicone implant, the iris implant. So let's take a look at this, and you can kind of walk us through. What are we seeing here?
So this is the handmade iris prosthetic. This is actually from the young fellow we looked at before with congenital aniridia. We use a tree fine, a little cookie cutter, to cut this to size because it comes a little bit larger than we need.
Right.
And you can see that this is made out of soft silicone. And if you look carefully, you see it has little folds, little rugae on the surface of the device, just like the natural iris. If you look at it, has all these little nooks and crannies. And so this looks very natural. We fold this so that we can insert it through a very small opening. This is just a cartridge that we put it in. Then we can...
So you're basically folding this thing up to put it into a cartridge to then deliver it into the eye.
Into the eye. And we're inserting this through an incision which is less than the tip of the diameter of the tip of a pencil. So it's very, very small.
You were just holding that between your fingers. Here we go. Now this is the eye.
So this is the cartridge we've inserted, and you can see this device is going into the eye, and it unfurls as it goes in.
Which is amazing. It kind of springs open.
It springs open because it's silicone.
Right.
It's very soft. It's very gentle to the tissues. Now, this is a device that's made in Germany, and this is part of the FDA clinical trials that we're now undertaking to determine its safety and efficacy. But we've done these before the clinical trials as a compassionate use. In other words, the FDA has given us permission on an individual basis. So we have some experience with this. It's been very positive. And this is a safe, I think this is a safe device.
So this is already opened up now. This is the implant opened up, and now what are you
And now what we're doing is stabilizing. When we take the cataract out, we leave the shell. We call that the capsular bag. And this is actually going into that shell to stabilize it. And then some scar tissue will form around the edge of that, and that's what will keep it in place permanently.
Wow. What's so amazing to me is that it just looks so incredibly natural.
Very natural.
Well,
very natural, very well tolerated, and produces excellent visual results.
Dr. Kenneth Rosenthal, you are changing lives and changing vision. I really appreciate it.
Thank you.
Great,
Thanks
very,
for having
very
me.
interesting stuff.